Welcome to the AEHR video training series presented by Information Technology Education at UK Healthcare. This course is intended as initial AEHR training for residents. This video is video number 2 in a series of 4 and is divided into a series of 4 chapters. This first chapter will introduce you to the process used to create a note in AEHR. In addition to showing you how to create a note, this chapter will also discuss dictation options available to help you document your note. Finally, this chapter will explain what information you will find in each of the sections of the note authoring workspace. The preferred method of dictation at UK Healthcare is Dragon. Dragon is a voice recognition program that will allow you to use a microphone instead of a keyboard to help you input text into your note. Dragon still requires that you use a mouse to click on radio buttons and checkboxes, but it can eliminate your need to type information into your notes. If your clinic will allow you to use Dragon, you will get information about registering for Dragon training from them. Training is a separate 16-minute web-based training module or a 1-hour face-to-face class that you are required to attend if you plan to use Dragon. Questions about Dragon can be directed to Jen Smith in IT Education. Her contact information is on the screen now. Some clinics in inpatient areas have the option to use 3M SoftMed telephone dictation. Information about this method of dictation will be provided to you by the clinic if you will be asked to use this system. You are not required to use any dictation. You're able to type directly into your notes if you prefer. However, know that there are dictation options available to you in order to help you speed along the process of creating a note for a patient visit if you choose. Typically, the most efficient workflow for you to follow is to start a note as soon as you enter the room to see the patient. You will be able to view the patient's chart as well as document any new discoveries into the note from the note authoring workspace. Every clinic has developed a set of specialized notes. You will learn these clinic-specific notes as you get into the clinic and start seeing patients. As an example for these videos, however, we will use an internal medicine established patient visit note. The specialized notes that you will use in your clinic will be similar to this note, but not exactly the same. However, you should be able to complete any note you may need to use by using the methods shown in this example note. As discussed at the end of the previous video, to start a note, simply press the Start New Note button on the clinical toolbar. It looks like a piece of paper with a plus sign on it. This will open the Note Selector screen. Click this button now. Your specialty should appear on the Note Selector screen by default. However, if it does not, you will need to select it from the drop-down menu. Today we're working in internal medicine, so select that now. From the Visit Type drop-down, you will need to select the type of note you wish to create. This is determined by the clinic you are in and the type of visit that the patient is here for today. For this example, we will select the Internal Medicine Adult Established Patient note type. Your name should appear in the Owner's field. If it does not, you may need to click the Binoculars button to search for your user ID. Do not select anything from the Incomplete Notes drop-down if it appears. This option should be used only if you want to finish a note that you started and did not complete. The option will only appear if this patient has incomplete notes on their chart. If you are creating a new note, do not ever select anything from this drop-down list. If you do, you will be completing an existing note rather than starting a new one. From this screen, it is also possible to add a chief complaint to the note. A chief complaint in AEHR is the patient's description of what is wrong with them. This is not a diagnosis, but rather a complaint such as pain, fever, swelling, etc. Some visit types, such as follow-up visits, will not have a chief complaint. Therefore, chief complaint is not a required field. However, if you wish to add one, this is the easiest place to add it. To add a chief complaint, first click the chevron to the left of Chief Complaint to open that section. Then click the Add Remove Chief Complaints hyperlink to open the ACI. Click that hyperlink now. In the search box of the ACI, enter the term that you wish to search for. In this case, we're searching for polydipsia because our patient is stating that they are thirsty, and searching for thirsty does not display any results. Sometimes you may need to search for synonyms in order to find the correct chief complaint. Click the binoculars now to search the master list for this chief complaint. Once you have located the correct term, click the checkbox to the left of that term to select it. Click the checkbox to the left of polydipsia now. Then click OK on the ACI window. This will return you to the Note Selector window. Everything on this selection screen is now complete, so you can click the OK button to start your note. Click OK now. The screen where you edit your note is called the Note Authoring Workspace, or NAW. The NAW is divided into 5 sections. On the left side of the screen is the table of contents. This lists the different sections of the note and allows you to jump between them. When you're moving to sections within your note, it is important to move by selecting the appropriate section on the table of contents. The largest section of the note authoring window is the note input area. This is where you will enter information into the note. When you select an area on the table of contents, that area appears in the note input area so that you can input information into that section of the note. Across the top of the note authoring window, there are a series of tabs. These tabs will allow you to view the patient's chart without having to leave the note. The tabs you see here are identical to the tabs on the clinical desktop. The information contained in the clinical desktop and the note tabs will be covered in more detail in the next video. At the bottom of the note authoring workspace, below the note input area, is the note accumulator. The note accumulator will allow you to see your note build in sentence form as you select checkboxes and radio buttons in the note input area. Any information entered using the ACI rather than the note input area will not appear in the note accumulator but will appear on your final note. In the lower left corner of the Note Authoring Workspace is the Note Viewing Options section. This is where you will be able to view the note, letters you create within the note, or other information once the note is completed. Simply check the boxes next to the items you wish to view and click the View button in order to see a print preview version of the document. Finally, please note that the Clinical Toolbar is docked across the top of the Note Authoring Workspace. You can always use the buttons on the Clinical Toolbar to add clinical information to the patient's chart, even from within your note. There are 2 ways you may choose to view the Note Authoring Workspace. By default, the note is shown full screen and there are tabs across the top of the screen allowing you to view different sections of the patient's chart. Anytime that the title bar of the window that you are working with displays Note Authoring, then you are viewing the patient's chart from a tab. In this circumstance, you can always return to the note by clicking the Note tab. It is also possible to view the patient's chart and your note in a split screen view. To do this, click the Tile button located in the upper right-hand corner of the Note Authoring Workspace. This will split the screen, allowing you to view the note on the left side of the screen and the patient's chart on the right side of the screen. You can always return to the default tabbed view if you wish by clicking the Tile button again. The easiest way to open an incomplete note for editing is to use the daily schedule. Once a note has been started on a visit for a patient, an icon of a piece of paper will appear on the daily schedule. If you wish to reopen that note for editing, you can simply single-click the piece of paper and it will open the appropriate note. Click the note that has been started on our patient now. Remember that notes are finalized if this paper icon has a green check mark over it, so those notes must be amended rather than edited. This chapter will introduce you to the clinical desktop or patient chart in AEHR. In this chapter, you will discover what information is located on the various tabs of the clinical desktop, as well as ways to access that information both when you are and when you are not completing a note. How much do you remember from Chapter 1 of this video? Drag the section headings at the top of the screen to the red box corresponding to that section of the Note Authoring Workspace in the image. When you are done, click the Submit button. The area on the left side of the screen is the table of contents. Remember that it is important to use this to move throughout your note. The tabs at the top of the screen are called the Chart tabs. They will allow you to see a patient's chart without leaving your note. The large area on the the right side of the screen is the note input area, where you will input information into your note. The area below the note input area is the note accumulator, where you will see your note build as you enter data. The small area in the lower left is the note viewing area, where you can see your note once it is created. And finally, the clinical toolbar is the toolbar at the top of the screen where you add information to the patient's chart. Refer back to Chapter 1 of this video for more detailed definitions of each of these terms. The clinical desktop is the patient chart in AEHR. There are multiple ways to access the information contained in the clinical desktop. If you are not completing a note, you can access the clinical desktop in the ways discussed in Video 1 when we discussed the daily schedule. If the patient is not here for a visit today, after searching for them, you can access their clinical desktop by clicking the Clinical Desktop tab. If the patient is here for a visit today, simply double-click on their name on the daily schedule. If you are documenting a visit note for a patient, you can access the clinical desktop by clicking the tabs across the top of the note authoring workspace. The information displayed here is identical to the information found on the clinical desktop. The clinical desktop is made up of a series of tabs that divide the patient's information into sections. When viewing the clinical desktop screen, this information is separated into two sides, simulating a paper chart. The information on the left side of the screen is more visit-specific information, while the data on the right side of the screen is more historical and administrative in nature. The Problem tab will show you all of the patient's problems. This includes active problems, which are diagnoses that the patient is currently being treated for, and past medical history, which are diagnoses that the patient has been treated for in the past but are not currently active. Also on this tab, you will find past surgical history, which is a list of the patient's past surgical procedures, family history information, and social history. You can discover more information about any item on this tab, such as a surgical date, by double-clicking the item. This information is typically added by the clinical staff during the intake process. However, later videos in this series will discuss how to add any of this information should you need to do so. The Allergies tab will display all of the patient's medication and non-medication allergies. The Meds tab will allow you to view all of the patient's current and past medications. To view past medications, click the Current Medications drop-down in the upper left corner of the Meds tab. Details about medication management are covered in a future video. The Vitals tab will show you all of the vital signs that have ever been taken on this patient. The most recent vital signs will always display in the column furthest to the left. The Immunizations tab will display all of the patient's immunizations that have been recorded. We will skip the Patient Work List tab as it will be discussed in detail in a future video. On the right side of the clinical desktop, you'll find the Documents tab. This is where you can read any previously created visit notes. To view a note, simply double-click it and it will open in a print preview window. The Results tab will display any lab or radiology results for this patient. Lab results that come back within normal limits are indicated with a white beaker next to the result. Lab results that are outside of normal limits have a red beaker next to the result. A U over the beaker icon next to a lab result indicates that the result has not yet been verified by the ordering provider. The steps for verifying orders will be covered in a later video. Double-clicking on any result will show more information about the result, including a history of previous results for that test if there are any. The HMP, or Health Management Plan tab, displays an overview of the patient's current active problems. This tab allows you to quickly review and manage problems, current medications, reminders, and recent results for the selected patient. The Orders tab will allow you to view all of the orders that are currently active for this patient. Orders are by default separated by status so that you can see why the order has not yet been completed. From the View drop-down, you can also elect to see current orders, past orders, or all orders. The Graphs tab will display flow sheets of patient information. Each clinic has selected which flow sheets they use, and they can all be selected from the drop-down menus at the top of the tab. The Visits tab will show you all of the patient's visits to any clinic within the UK healthcare system. This is the same information that you can view from the Quick Appointments option of the clinical toolbar. The Fees History tab will allow you to view any of the encounter forms or fee tickets for this patient's previous visits. The Correspondence and Admin tab is where you will find any correspondence or administrative documentation for this patient. This includes letters that have been sent regarding this patient, documentation of telephone calls with the patient, return to work notices, and copies of clinical summaries from previous visits, among other things. The Outside tab will display any medical records from outside of the UK healthcare system. Scanned records will display a red S next to them. There are multiple views available for the clinical desktop. You can select the view you need from the drop-down menu right above the clinical toolbar. Most users will use the UK patient view exclusively. This view will show all of the tabs just discussed. However, if you work with pediatric patients, you may wish to use the UK pediatric view. This will allow you to access to the growth chart tab, where you are able to view a growth chart for your patient. There are 3 growth charts available: standard, prematurity, and Down syndrome. If you work with obstetrics patients, you will want to use the UK OB patient view. This view will give you access to a prenatal button at the bottom of the Documents tab. This prenatal button will open the standard ACOG form to allow you to complete it. Once it has been completed, a document will appear in the Documents tab where you can review the information already entered on the ACOG form. Finally, if you work with surgery patients, you may wish to use the UK perioperative view. This view of the clinical desktop will allow you to view pre-op orders, consents, and H&P in individual, easy-to-find tabs on the right side of the screen. All of the tabs that have been discussed in this chapter can be accessed from the tabs in the note as well as from the clinical desktop. This third chapter will discuss a patient's active problems. This chapter will demonstrate how to add a new active problem, resolve a problem that a patient is no longer dealing with, assess a problem that you are seeing the patient for today, and suppress problems that you do not wish to view in the patient's chart. We will look at ways that AEHR can help you to use ICD-10 billing codes for your assessments, and finally we will discuss your My Priority view when looking at problems and your favorites list in the ACI. While in your note, clicking the Problem tab will allow you to review, add, assess, or resolve active problems for your patient. Remember that active problems are current problems that the patient has been diagnosed with by you or another provider. You may need to add new active problems when a patient visits another provider and receives a diagnosis, or when you are documenting information for a new patient. To add a new problem, use the Problem button on the clinical toolbar. Click it now. Then search for the problem by typing it in the search field. If you press Enter or click the binoculars after searching in the ACI, then the system will search the entire listing of problems. Typing the search item without pressing Enter or clicking the binoculars button will search your list of favorites. Favorites will be discussed later in this video. Once you have found the problem that you are searching for, click on the text for that problem. Do not click the notebook icon. That icon will be explained later in this video. If you wish to add more information about an active problem, you may do so by right-clicking the item and selecting Edit. This will give you an area where you can add additional information such as a diagnosis date. Once you are happy with the information that you have input, click OK on the ACI screen to return to your note. Go ahead and click the OK button now. Once you have added a problem, it is not saved into the patient chart until you commit the information. It will display in magenta to let you know that the information has been entered but not yet saved. It is not necessary to commit your data after every change or new addition, but it is good practice to commit every so often so that you don't lose any data. To commit, click the yellow Commit button on the clinical toolbar. Click it now. Note that the Commit button will only be yellow when you have unsaved data that has been input and needs to be saved. On the Encounter Summary screen, you can uncheck anything that you do not wish to save. Once everything that you wish to save is checked, though, click the Save and Continue button. Click Save and Continue now. Resolving a problem will remove the problem from the active problems list and move it to past medical history. This is done when a diagnosis is no longer a current problem for a patient, but you wish to keep a record of it in their chart. Use this for problems that may recur and become chronic, like gastroenteritis or ear infections, so that you can keep a record of them. The Resolve option is typically used used when you are simply recording that the problem is resolved, not when you are diagnosing the problem as resolved. So you would typically use this option if the patient tells you that the problem has resolved itself. To resolve a problem, right-click it and select the Resolve option. Select the Resolve option now. The problem will move to the Past Medical History section of the chart. A problem can be resolved and suppressed when you do not wish for it to appear in either the Active Problems or the Past Medical History section of the patient's chart. A common but not chronic ailment such as the flu or strep throat may be a good example of when you would want to suppress the problem in addition to resolving it when it's no longer active. Typically, there is not a need for these ailments to appear in the Past Medical History section of the patient's chart. To resolve and suppress a problem, right-click over the active problem and select Resolve and Suppress. Select the Resolve and Suppress option now. The problem will disappear from the active problems list and will not appear in the Past Medical History section of the chart either. Any existing problems that you examine during the current patient visit will need to be assessed. Assessing a problem includes that problem on the billing for this encounter. To assess an existing problem, simply click the notebook icon to the left of the problem on the Problem tab. Click the notebook icon now. You can also click this notebook icon on the ACI screen when you're adding a new problem. Another option is to right-click over the problem and select the Assess option. Go ahead and select the Assess option now. Any of these methods will place a green check mark over the notebook icon to the left of the problem. This green check mark indicates that the problem has been assessed during the current encounter and will be included on the billing fee ticket. When right-clicking over a problem, you can combine some of these options. Assess and Resolve will move the problem from active problems to past medical history and will also identify it as a problem assessed during this encounter. Assess, Resolve, Suppress will remove the item from active problems and from past medical history and also includes it on the billing for this visit. When viewing active problems in the Problem tab or in the ACI, you will notice two columns for billing codes next to the problems. All problems are identified with both an ICD-9 and ICD-10 code for your convenience. These codes may be used when searching the ACI in lieu of typing the name of a problem. Some patients have very long active problem lists. In order to see just the problems that you specialize in, you may want to set a My Priority view. This will allow the problems that you work with to rise to the top of the list of active problems. To add a problem to your My Priority list, right-click over the problem and select Add to My Priority. In order to view the items you have selected to be part of your My Priority list, you must change the tab view so that you are only seeing the active problems. Then you need to change your view type to My Priority. Then you'll be able to see the problems that you are interested in at the top of the screen to make them more easily identifiable at a glance. You can also select My Priority view on the left side of the ACI screen so that you will be able to see your preferred problems first there as well. When searching in the ACI, you have the option of setting a list of favorite items that the system will search first before searching the master list of problems. For instance, if you often see cases of strep throat, you may want to set that as a favorite item so that you do not have to search every time you wish to add it to a patient's problem list. To add an item to your favorites, right-click over the item in the ACI and select Favorite Item. While it will look like nothing happened, you can right-click over the item again and see that the favorite item now has a check mark next to it. This indicates that this item is on your favorites list and you can now select it from the main screen. Also, if you are entering text into the search box, the system will search the favorites list first. If you wish to search the master list of all of the items, hit the Enter key or click the binoculars button after typing your search term. You may also select items to place on a quick list. The quick list should be a very short list of only the most common items that you need to select from the ACI. Items placed on the quick list are automatically also placed on the favorites list. To add an item to the quick list, select the quick list option from the menu that appears when you right-click a problem. To view your quick list items, click the quick list icon that appears at the top of the ACI tab that you are working with. This fourth chapter will discuss reviewing and editing medications and allergies. This chapter will show you how to review, renew, discontinue, continue, complete, and reconcile medications. We will also discuss reviewing, adding, and reconciling a patient's medication and non-medication allergies. To review the list of current medications that a patient is taking, click the Meds tab. The information displayed here is the same as the information shown on the Meds tab of the clinical desktop. By default, you are viewing the current medications for the patient. However, you can view past medications by selecting that option from the Medication View drop-down menu. To view more information about a medication, including renewal history if applicable, double-click on any medication. Medication history is defined as any medications that the patient is taking when they walk into the clinic for their appointment. This does not include any medications prescribed during the appointment. In most clinics, a patient's medication history is input by the clinical staff during the intake process. However, if the patient does not disclose a medication to the clinical staff but does tell you about it, you may need to add a medication history item. To add a medication without prescribing it, use the P button on the clinical toolbar. Then select the MedHX tab. Search for the medication that the patient is taking. If they do not know the dosage amount, there is always a generic option available. Simply check the box to the left of the medication that the patient is taking to select it. If you wish to add how often the medication is taken, you can right-click over the medication and select Edit. More information options for selecting medication SIGs will be covered in an upcoming video when we discuss prescribing medications. You may wish to renew a medication during a patient visit. To do this, simply right-click over the medication and select Renew with Changes. Select the Renew with Changes option now. It is important to always select Renew with Changes rather than Renew. The Renew option will renew the medication exactly as it was entered without giving you the opportunity to make changes to the prescription. This means that if the medication was entered as medication history and you use the Renew option, the medication will not be sent to a pharmacy but will instead be renewed as a medication history item again. Using Renew with Changes will give you the opportunity to make sure that the dosage, SIG, number of refills, and pharmacy or prescription method are all correct before renewing the medication. If everything is correct, select OK to renew the medication. Assume everything is correct for this particular medication, so click OK. More information about the options available on the renewal screen will be discussed in an upcoming video that will show the process for prescribing medications. There are two options for discontinuing a medication. Both options are accessed by right-clicking over the medication. If you are the one telling the patient to stop taking the medication, then use the Order DC option. Click the Order DC option now. You will then be asked to select a reason why you are discontinuing the medication. The other option for discontinuing a medication is Record DC. This is used when the patient chooses to stop taking the medication or when a provider outside of the UK healthcare system tells the patient to stop taking the medication. In either case, when you discontinue a medication, it will appear under past medications with the reason that it was discontinued. If you wish to document that you told a patient to continue taking a medication that doesn't require a renewal, like an over-the-counter medication, you can continue that medication in AEHR. In order to continue a medication, simply right-click over the medication and select Continue. A medication window will appear that will allow you to e-prescribe the medication. If nothing needs changed, simply click OK. The medication will remain on the current medications list and will turn pink to indicate that you need to commit the changes. If the patient completes the prescribed amount of a medication but the medication still appears on their current medications list, you may need to complete the medication. To document a medication as completed, right-click the medication and select Completed Today. If the patient finished the medication on a date other than today, you may also select Completed On and pick the date that that medication was finished. After completing the medication, it will move from the current medications list to the past medications list. It is necessary for someone to reconcile a patient's medications on every visit in order to meet meaningful use requirements. Some clinics have the clinical staff performing this function, but most clinics require that a provider reconcile medications. Reconciling is simply verifying that the patient's medication list is correct. When medication reconciliation needs to be done, then the Rec button at the top of the Meds tab tab will be yellow. If it is not yellow, then someone else has already performed the reconciliation. To reconcile a patient's medications, simply check with the patient to ensure that all of the medications listed in their chart are current and accurate. Then click the Rec button to document that the reconciliation has been done. Click the Rec button now. The yellow background for the Rec button will disappear once the medications have been reconciled. You are able to review a patient's medication and non-medication allergies by clicking the Allergies tab. This is the same information that can be viewed from the clinical desktop. Allergies are typically entered by the clinical staff, however, you may wish to review them during the process of examining the patient. If you need to add an allergy for a patient, you may do so by clicking the P button on the clinical toolbar. From here, click the Allergies tab. When searching for an allergy in the ACI, it is important to make sure to check the upper right-hand corner of the window to ensure that medication or non-medication is selected. If you do not select the correct radio button here, then you may not find the allergy you are searching for. Once you have found the allergy you're looking for, click the checkbox to the left of that allergy. You may right-click an allergy and select Edit to add any known reactions. If the patient does not have any drug allergies, select the checkbox to the left of No Known Drug Allergies. No Known Drug Allergies should appear on your favorites list for you, but if it does not, you may have to search for it. Just as it is necessary to reconcile the patient's medications on every visit, it is also necessary to reconcile the patient's allergies on every visit in order to meet meaningful use requirements. Typically, this is completed by the clinical staff. However, if they do not complete the reconciliation, you will need to. This reconciliation process is exactly the same for allergies as it is for medications. Simply check with the patient to ensure that all active allergies are documented, and then click the Rec button at the top of the Allergies tab. If this button is not yellow, then this task has already been completed by the clinical staff. From the Section tabs located at the top of the screen, you may also view the patient's orders, vitals, immunizations, flow sheets, documents, and results. In order to return to your note, click the Note tab. It is important to check the title bar of the window that you are working with to make sure that it still says Note Authoring. As long as it does, it is not necessary to create a new note. Instead, you may simply click on the Note tab to return to your note. This concludes video number 2 in the AEHR for Residents series. Please remember that you must watch all of the videos in order and pass a competency to successfully complete this course. The next video in this series is video 3, Documenting a Note, Prescribing Medications, and placing orders. This video was brought to you by Information Technology Education at UK Healthcare. For more information, contact the Learning Center at 257-9226.